Hi, everyone. Thank you very much for connecting to our seminar today. I hope that you're all well and that you're all staying safe at your homes. My name is Veronica Frisancho. I am a senior economist at the research department at the IDB, the Inter-American Development Bank. For those of you who are joining us for the first time, this is a seminar that is part of a series of seminars that our research department organizes, and it is called EconNet. Given our new normal, we have adopted this virtual format, and most of our upcoming seminars will follow the same format. And we will focus mainly in COVID-related topics that are relevant for countries in the Latin American region. Today we have Emily Leslie, Assistant Professor at Brigham Young University, presenting her paper, Sheltering in Place and Domestic Violence, Evidence from Calls for Service During COVID-19. Emily's work focuses on law and economics with a focus on crime and the criminal justice system. Today, in particular, Emily will present her novel work joined with Riley Wilson to quantify the increase in domestic violence during the lockdowns implemented in the US. This is a topic particularly important for us in the Latin American and the Caribbean region, where intimate partnered violence was already rampant and widespread pre-pandemic. So before passing the microphone to Emily and welcome her to our seminar, let me quickly go through the rules that we have for the rest of the time allocated to the seminar. So first, there will be no breaks for questions during the seminar unless it's a very, very urgent and pressing question that you need to clarify before moving forward. And in that case, I will ask you to raise your hand and I will give you the power to speak. The speaker will have 40 minutes to present, and then we will have the remaining time allocated to questions and answers. During the presentation, you can type your questions in the chat, and I will moderate them, and some of them will be replied directly by Riley in the chat, who's going to be joining us as well during the full presentation. And at the end of the talk, I will choose as many questions as possible to pass on to Emily and Riley and let them answer them live. So during the Q&A, if you still want to speak up and ask the question directly to Emily, I ask you to raise your hand and I will see if we have time to give you, to unmute you and give you some time to interact with Emily directly. So now let me pass the microphone to Emily, and thank you very much, Emily and Riley, for joining us today.
Right. Let me share my slides. There we go. Did those show up all right, Veronica?
Yes, perfect.
Perfect, thanks. Thank you so much for having us. We're excited to be presenting to this group and looking forward to hearing your comments. So the starting point for this paper is recognizing that the COVID pandemic has created sort of a perfect storm for increased domestic violence. We've seen ballooning unemployment in the United States and in other places. In the United States, the unemployment rate was, I think, about 3.5% in January, rose to almost 15% in April. There's been, rampant job loss, many workers having their hours reduced. About 35% of workers shifted to doing remote work. Of course, on top of all of that, we've got schools being canceled, childcare arrangements being disrupted, anxiety about medical and health issues. And all of these are things that kind of fit into factors that in the domestic violence literature have been linked to higher rates of domestic violence. So there's evidence that worse labor market opportunities and more labor market uncertainty, as well as increased parental time at home, especially during unemployment, and negative emotional shocks all lead to higher rates of domestic violence. So our goal in this project is to offer the most careful evidence that we can on this question of how the COVID-19 pandemic has affected domestic violence. And to be clear from the beginning, as I just listed a whole set of ways that the pandemic might increase domestic violence, and those are all in the bundle of treatment that we're considering here. I'll talk a little bit about mechanisms at the end today, but ultimately we don't have the right kind of variation to tease apart the different strands there in a really tidy way. So our central question is whether the pandemic and everything that goes with it, the public health response, the behavioral responses, the policies, all of that, increased domestic violence. The measure that we're using for domestic violence is calls to the police that are likely domestic violence incidents. And we know that domestic violence reports, those numbers are not equal to the number of domestic violence incidents. Underreporting is always an issue when you're studying crime. We might be especially concerned about underreporting when we are thinking about domestic violence. If the pandemic had a direct effect on reporting patterns, then that has implications for how we should interpret our findings. You may think if there are more people at home, then there are more neighbors at home, we could have higher third-party reporting rates, and that could cause us to find an increase in reports that's not driven by an increase in incidents. We have a little bit of evidence that we can show you that's not consistent with that story. We don't think that third-party reporting, increases in third-party reporting are driving what we find. You may think that victims are less likely to report during the pandemic because maybe they feel trapped with their abuser, they're more worried about retribution. In that case, our estimates would understate the true effect on domestic violence incidents. So as you may be aware, the media has paid quite a bit of attention to this question of domestic violence during the pandemic. We've seen, here's just a sampling of 3 headlines from large news outlets. We've seen reports about increased traffic to domestic violence websites and hotlines. It doesn't seem to be a phenomenon that people are only reporting on in the United States, but globally as well. And it is true that within our data, if we look just at 2020, the levels in March and April are higher than the levels in January and February. That said, there are seasonal trends in a lot of crime categories, and we want to be sure that we are taking the possibility of seasonal trends into account when we set up our empirical approach. Another question is, how did the state and city lockdowns, the stay-at-home orders, the shelter-in-place orders, how did those relate to the timing of the effects? Does it look like the effects that we measure kicked in after those policies went into effect or not? There's a few working papers that present evidence that stay-at-home orders can't explain all of the economic declines that we've seen with COVID-19. So maybe we shouldn't assume that they are going to be the source of domestic violence effects either. This is a figure that kind of sums up our strategy and our main result in a single picture. The black dotted line and the solid black line are mapping out calls for service numbers from 2019 and 2020. So they're actually the log or the inverse hyperbolic sign to deal with zeros, but basically they're the log of daily domestic violence calls averaged at the week level to smooth things out. And you can see if you look at the dashed line for 2019 that there is in fact an upswing in the spring. And I could show you the same lines for 2018 and 2017 and you would see that same uptick in the spring. The reason that we're focusing on 2019 here is because we constructed this sample to maximize the number of cities that we could include, and not all of the cities for which we have data have it going back multiple years. But this seasonal upturn that you see in 2019 is not unique to that year. However, the upturn in 2020 appears to be substantially larger, and that will bear out in our analysis. We're going to find that the pandemic is associated with a 10% increase in domestic violence during these last 3 weeks in March. Now let's just talk for a minute about timing. If you look at this vertical blue line on the right, that marks the date of the first shelter-in-place order that came into effect in the United States. That was in the state of California. And you can see that it is kicking in well after that gap in domestic violence numbers starts to open up. If we look instead at trying to measure when behavior changed, when did people start, avoiding public places or staying home more, this green line is an example of some data that we could use for that. This line comes from open table data, and it's measuring the percent change in the number of seated restaurant diners in 2020 compared with 2019. So you can see that there's quite a precipitous drop here starting the second week of March compared with the previous few weeks. The red line is just kind of marking for us when the beginning of that drop occurred. So people stop going to restaurants, and around the same time we see a gap opening up. That's going to foreshadow, what we're finding, that the domestic violence effects, the timing of the domestic violence effects goes along with the timing of behavior changes, not just when state policies came online. Now let me step back and give you a little more detail about the data that we're using to measure domestic violence. We are using police calls for service logs, and these data sets are really useful in the situation for a few reasons. One is that they are available really quickly for at least the cities in our sample. So we can get 2020 data, unlike a lot of the other crime data sources that have been used more frequently in the literature. They include, these are 15 cities that we identified for whom we can get calls for service data in 2020 that include enough detail in the incident description for us to identify likely domestic violence incidents. And the calls, so this is call level data, and the calls that we tag as likely to be domestic violence have phrases like domestic violence, domestic disturbance, or family dispute in the incident description. Some of the cities also include pretty fine location information so that we can get down to the census tract level, which is quite a small geographic unit. And that will be useful for at the end when we spend a few minutes talking about mechanisms. We'll be able to merge on census tract characteristics to look at heterogeneity across different types of communities. So we don't have exact home address, we don't know demographics of the people making the call, the possible victims, or any of that, but we do know location for some of the cities, and we're able to identify likely domestic violence incidents. So for most of the analysis, we'll be working at the city level because that's the finest geography that we have in common through all of these places that are in our data. Our strategy to quantify the effect of the pandemic on domestic violence is to use a difference in differences. It's a little bit unconventional because both of the differences are across time. So we'll be taking the cities, the 15 cities in our data in 2019 compared with those same 15 cities in 2020. And then we'll be looking before and after the pandemic kicked in around the beginning of March. So to do that, we have to actually pick a date for when we think the pandemic was taking off in earnest in the United States. I have a few data sources that I'm going to show you that we are using to kind of hone in on what date we want to choose. So this is SafeGraph data. It uses cell phone geo-tracking, and this data is really useful and also very easy to get access to. You do have to request access, but it's free and they're letting researchers have it easily. So if this would be useful to you, you should definitely look into it. They have much finer geographic data than just the state level. It gets down to much finer levels within, for various measures. This measure that we're using here is just the share of devices that don't leave their home at all on a given day. And we have a line for every state in the United States, with darker lines for the states that appear in our sample. So as with the first figure I showed you, you can see that the first shelter-in-place order comes into effect after there's already a marked increase in the share of people who are staying home, entirely at home. This line marks March 9th. This ends up being the date that we choose for our start of treatment date. Our results aren't sensitive to using that exact date. We can perturb it in both directions without changing anything within a reasonable window. So SafeGraph data corroborates that we probably shouldn't use the shelter-in-place orders as the start of treatment. Similarly, Unicast data, which is also cell phone tracking data, is measuring the amount of non-essential travel. That they categorize travel as essential versus non-essential. So the amount of non-essential travel that people were engaging in also falls off quite a bit before that first shelter-in-place order went into effect. Something else I want to point out actually as we're looking at these is that the trends and pattern timing wise in all of the states are very similar to each other. There's not a lot of geographic variation here across states in terms of when people started to travel less and stay at home more. And so although we do a robustness check where we assign place-specific treatment timing, it doesn't change our results, and it's not surprising because the dates that we assign by looking at these data sets that I'm showing you are all very tightly clustered together. This is, again, open table data. So the same data set that I used in the very first figure, now disaggregated by state. And again, drop-off is coming well before the shelter-in-place order. And finally, search intensity for social distancing, this new phrase that no one used 6 months ago, took off around the same time as people started to try themselves social distancing, and was already in full swing before stay-at-home orders went into place. So here's the specification that we're going to be estimating. We will be interested in domestic violence calls, both the level of calls per day and the log or inverse hyperbolic sine of calls. The coefficient of interest is beta. It's the coefficient on this interaction term, which is a dummy. Post indicates days that are after March 9th in both 2019 and 2020. So to be clear, the way that our sample is constructed is we take the first 3 months of the first 3 months of the year in 2019 and in 2020. And so any day that's after March 9th in either of those years will have a value of 1 for this indicator. We have re-estimated the model using all of the remaining months in 2019 to help identify the fixed effects, and it doesn't really change our findings. Year 2020 is a dummy for days that are in 2020. So we want to see how different the days after March 9th in 2020 are. And we have city fixed effects, year fixed effects, week of year fixed effects, and day of week fixed effects. We want to cluster at the city level, but there are only 15 cities, and so we bootstrap the clusters. So the standard errors. So I'm going to, when I show you the table, you'll see coefficients, confidence intervals, and p-values, because those are the simplest thing for us to report after running the wild bootstrap. Then to account for the possibility that trends could be different in different cities, we're going to introduce, adapt the specification to have some interactive fixed effects. So, we have cities in Arizona in our sample. We also have Detroit in our sample, which is much colder and could easily exhibit different seasonal patterns. So we, in this specification, have city by year, city by week of year, and city by day of year fixed effects. So if cities have their own idiosyncratic trends, then we can pick those up and take care of them here. Either way, the identifying assumption we have to make is a version of the parallel trends assumption. We have to be willing to assume that the trend in 2020 would have followed the same trend that we saw in 2019 had the pandemic not broken out. We can explore the plausibility of that assumption and the dynamics of effects using an event study. So this is very similar to the specification above, except instead of having a single interaction term, we have interaction terms for every week. So we've got a dummy for each week of the year interacted with the year 2020 indicator variable. And then we can use that, we can trace out these coefficients to see if the pre-trends look flat before and how effects evolve after the pandemic hits. Here are the difference in differences results. Column 1 is not a difference in differences model. This is just for comparison. This is the numbers, that we get if we just make a naive comparison between the last 3 weeks in March and the first couple of months of the year. So if we didn't account for seasonal trends and just an interrupted time series, then we would infer that the pandemic increased domestic violence calls by 15%, which is about 5 calls per day per city. Columns 2 and 3 are estimating the diff and diff specifications that I showed you in the last couple slides, where column 3 has the full set of interactive fixed effects. So by taking seasonal trends into account using 2019 as a control year, we're finding substantially smaller effects. And so if we don't account for seasonal trends, we're going to overstate the magnitude of the effect by about 50%. That said, a 10% increase in domestic violence is still substantial and I think enough to be worried about. That corresponds with about 3 additional calls per city per day. Here's the event study figure. So the first thing that we want to check is to make sure that the pre-trends look relatively flat, and they do. None of these coefficients are statistically different from 0. Many of them are very close to 0. And then starting the week of March 9th, there's kind of a clear jump up. We see coefficients that are systematically higher than what we saw before that week. If we want to know what happened, I'm sorry that I haven't updated my slide. We just yesterday incorporated data through the end of May. We can't do that for all of the cities in our sample. They haven't all released data, but I'll show you the event study. Standard errors are larger because there's fewer cities, but can give you a sense of the pattern. We see, higher effects and they start to drop down. This is going to be mid-April right here. These coefficients over here are probably not statistically distinguishable from each other, but I will say that the majority of the stimulus checks in the United States went out in the middle of week 15. So I'm not trying to assert that we have identified the effect of the stimulus checks on domestic violence or anything like that, but I do think this pattern here is consistent with the stimulus checks doing something to improve the safety of households that are under financial stress. So I think that that's something that I would be very interested to see more work on using data or in a context that has the right variation to do it. Let's see. Now let me just tell you again, I've mentioned some of these robustness checks already. So I've told you that we can, that the trends in 2017, 2018 look similar. If we rerun our analysis on the subsample of cities that have data for those 2 years, we get very similar results. Also, if we exclude each city one by one, our coefficient is very stable. So you might think Los Angeles is a very large city compared to some of these. Is it just one big city driving the effects? And the answer is no, it's not. Instead, we could perturb the the date when we say treatment started earlier and later in the year without changing much. So here, March 9th is the date that we're using. You can move it forward and back without it making much of a difference. If you move it far enough into March, then the coefficients will start dropping off. You're contaminating the control group with treated days the further into March you move it. But, you know, there's a reasonable window here around the date that we're using in which the effects are virtually the same. Here you can, in column 2, you can see that if we assign city-specific treatment timing, the coefficient is similar. If we include the rest of 2019, similar. If we include, there we are, the previous 2 years before 2019, similar. We can use Poisson or negative binomial models and get the same thing. So there's a lot of variations on a theme here. We've tried a lot of different things. The results come through in every version that we've run. This is another robustness figure that I find very compelling. What we did to make this figure is we ran a bunch of placebo tests. So we said, let's take the cities that have 2018 data and use 2018 as a control year, and then assign a bunch of placebo treatment dates in 2019. And then we'll rerun the diff and diff model and see what coefficients we get, you know, for all these different treatment dates that we're picking, these pretend treatment dates in 2019. This is a histogram of the coefficients that we get when we do that. The solid black line over here on the right shows you the size of our estimate from the table that I showed you. The dashed line is also showing a diff and diff estimate. It's just if we use 2018 as a control year for 2020 instead of 2019 to make the comparison more comparable, this is the coefficient we would get. So what I take from this is, first of all, that 2019 and 2018 have fairly similar trends because all these coefficients are pretty small. So 2019 isn't just a weird year in terms of its patterns, it's similar to 2018. So that's encouraging and suggests that it's reasonable to use it as a counterfactual for 2020. Also, the estimate that we get in 2020 is, you know, double the size of the largest in magnitude placebo estimates that we get. And that tells me that what we're picking up in 2020 really is a deviation from the trend that we would have reasonably expected had the pandemic not occurred. This is a clear break in the pattern of preceding years. So now let's touch on heterogeneity and mechanisms for a minute. As I mentioned, we have geolocation information in some of the cities that we can use to identify the census tract, and then we merge on census tract characteristics. One thing we do with that to get at the question of third-party reporting is we compare effects in neighborhoods that have a lot of multi-unit homes compared with neighborhoods that have very few multi-unit homes. So multi-unit homes have shared walls. You might think third-party reporting is more likely to happen when neighbors are sharing walls with each other and can hear more of what's going on in the next unit over. So if there were a large increase in third-party reporting, I would expect it to be concentrated in neighborhoods with more multi-unit homes. But in fact, these two neighborhood types have very similar effects. So based on that, you know, that to me undermines this as a possible mechanism that there's just a bump in third-party reporting going on. I heard some information corroborating that from the CEO of the National Domestic Violence Hotline here in the United States in a panel discussion the other week. She said that they have seen an increased traffic on their hotline since the pandemic broke out. And she also said that the composition of calls that they're getting is similar. So composition meaning, or is the caller calling for themselves, or are they calling for someone else? That kind of breakdown. She said that composition has been similar, through the outbreak of the pandemic. So those are my 2 data points to say that I don't think that what we're seeing here is just a third-party reporting effect. If anyone has ideas about ways that we could add more evidence to the question of reporting patterns, I'd be happy to hear them. I think it's an important one. And very open to having more discussion about that. Another question that we ask is whether the increase that we're seeing appears to be concentrated on the extensive or the intensive margin. So are these, does it look like these are households that have had domestic violence calls in the recent past or not? So what we don't see the specific street address of the call, but we can, at the city block level, say where there are calls for domestic violence from this block within the last 3 months or 6 months or 12 months, and compare blocks that have had calls, so repeat call blocks with blocks that haven't had calls recently. And when we do that, we find 4 blocks without recent calls. That's in column 3, column 5, and column 7. We see large statistically significant effects. So that is consistent with a substantial increase on the extensive margin, new households experiencing domestic violence that weren't, at least in the recent past. The blocks that have had calls, the point estimates that we're finding here are actually negative, but they're also very noisy. So I want to be careful not to read too much into them. But my takeaway from this is that there probably is some movement on the extensive margin. And to the extent that there is persistence in domestic violence, that households that experience domestic violence now are more likely to engage in it in the future, I think this is cause for concern. Here's, again, the list of mechanisms. I had this at the very beginning, but these are the things that in the literature are linked to higher rates of domestic violence. And we would love to be able to disentangle which of these, how much each of these is contributing to what we're seeing. And at the end of the day, unfortunately, we can't do very much there. So I'm going to show you this figure. There's a lot of coefficients plotted here. I'm showing this to you because this is a figure that I wanted to see myself when we started the project. I wanted to know what heterogeneous effects look like. And we've looked at this a lot, and in part because we don't have the statistical precision to probably do all of these cuts in a really clean way. There's not a super clear story that emerges from this. When I see this, I see evidence that there are substantial domestic violence effects across all kinds of communities. There's evidence from other researchers that the economic effects of COVID-19 have hit low-income households, people of color, and immigrants harder in the United States than others. But when I look at this figure, I don't see evidence of larger effects in low-income households, where there are a lot of households earning below $25,000 a year. There are certainly not higher effects in high Hispanic areas. So it's just a little bit unclear whether that's because of statistical, sampling noise, or whether the point estimates here really are telling us about the true pattern of domestic violence effects across these different areas. We are seeing, if you want to look at weekdays versus weekends, larger effects on weekdays. So those are the times when people are probably spending more time at home. So I think that's as we would expect. if time at home is playing a role here, and especially trying to work from home. And down here at the bottom, you can see the two coefficients that I referenced before, the areas without a lot of multi-unit housing and the areas with a lot of multi-unit housing. So those are very close, and again, suggests to me that third-party reporting is not driving our findings.
Emily, you have 5 more minutes.
Oh, thanks, Veronica. Perfect. So to sum up, we find that the pandemic has led to a 10% increase in domestic violence calls for service. That translates to 3 or 3.5 additional calls per day per city on average. I recognize that our sample is not a random sample of the United States, but if we just tentatively scale up our, the magnitude of our results to a national level to get a ballpark idea, we would expect to see about 1,400 more incidents per day, or calls per day rather, in the country as a whole. There's some limited evidence on the cost to domestic violence victims in terms of lost productivity, missed work, things like that. And based on what there is, we're estimating costs of about $6 million a day. That doesn't even take into account longer run impacts on earnings or health, as well as, the many aspects of the victim experience that are not easily measured and therefore are harder to study. So, I think I view this increase, a 10% increase in domestic violence calls, as reflecting a large additional cost of the pandemic on our communities. It's also important to remember that the social distancing behaviors and domestic violence incident increases began before the state shelter-in-place orders. So we should not think of the shelter-in-place and stay-at-home orders as the on-off switch for these domestic violence effects. I'm not saying that they aren't. They may play in. They may contribute as they, are turned on and off, but they're not the only thing at play here. On the other hand, I would be very interested to see research that tells us something about how relieving financial strain in a situation like this helps to mitigate the impact on domestic violence rates. So that sums up what we've done here, and I'm looking forward to fielding your questions and hearing your feedback.
Thank you very much, Emily. Riley has been super efficient answering all of the questions we had so far in the chat. So while we wait for others that might have some additional questions, I will take advantage of the mic and ask you a couple of questions of my own. So the first one is getting into the channels and the mechanisms that operate behind this increase. Is it possible for you to disaggregate between different types of violence, if it's physical violence or sexual violence versus emotional violence? And that might also be correlated with the, with the increase in new violence that you observe towards the later analysis that you conduct. That's one point. The other one is, I'm not sure if the robustness checks and your methodology in itself are able to correct for the substitution that might exist between reporting face-to-face and reporting through the hotline. So even though you add all these, you have the difference in difference, but I'm not sure if this spike that we see in calls is just replacing the reports that you would make in person. And is there any way that you can show us some evidence or robustness check designed to discard the substitution effect? The last one is more of a comment on the heterogeneity analysis that you showed towards the end. It's quite interesting, and I agree with you that it's hard to make out a pattern from the graph. But one thing that might be happening is that there might be a greater level of acceptance or normalization of violence in certain communities with high baseline levels to begin with. So you might not observe the reporting or the increase in the calls because they're used to it in a way, right? So it would need to be like, it would need to be above certain threshold for the person to call and report it. So I'm not sure if you can use this to kind of disentangle more into the heterogeneous effects based on the baseline reporting instead of characteristics as a whole, right? Like maybe there are certain pockets of high violence that are going to experience a lower change compared to others that have lower baseline levels. And this is, again, related to the new violence episodes that you find. So I'm going to pass the mic back to you. And I see that there are more questions coming in. So while you answer this, I'll organize the others and ask you the next round next.
Great, thank you. Yeah, those are great, great issues to raise. And as far as disaggregating by the types of incidents further within domestic violence, some of the cities have enough detail in the incident descriptions that might be feasible to find, you know, incidents that are related to assault or something that describes a physical violence. I know that they don't all have that level of detail, and the descriptions are pretty crude. Sometimes they're kind of like acronyms, you know? So I'd have to go back and look, but I think that's an interesting idea to try to think about the different types of domestic violence incidents and whether that can shed light on what's going on. Let's see, face-to-face. I would say that I haven't looked for information on how many incidents in general get reported to the police, like face-to-face as opposed to on the phone. I guess my assumption would, my prior is that people would be more likely to call the police than to go to the police, but that may not be true. May not be true for domestic violence. So I could try to see if there's evidence on that. It's definitely true that if you look at total calls to the police, those like crater after March 9th, those go way, 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 way down. So the police are getting fewer calls by a lot, especially at the end of March. But yeah, I haven't looked into face-to-face reporting rates, and I think that's interesting to think about. And then as far as using baseline rates, yeah, we haven't done that, and that's a good suggestion. So thank you for bringing that up.
If you could stop sharing your screen. Sorry, yeah. I didn't.
No, it's fine.
Before, but I'm gonna have two questions, one from Julian Messina and the other one from Andrew Morrison mixed together, because they both want to know more about what we can do. Is there room for policy? And if it's possible to think about what can we do in the months to come, especially because towards the end you mentioned that your data suggests that it's not precisely the lockdown, that violence has started even before the lockdown. So even when we're out of the lockdown, this spike might continue and the issue might still be there. So Andy, for example, suggests to look into municipal level measures of a strength of policy response. Maybe you can look at the number of employees at the hotlines or the police enforcement. So if you can elaborate a little bit more on that. And we have another, I mean, it came up before. Please, if you have a question, make sure that you send it to all participants and not just panelists. But we have a couple of questions about the seasonality of the violence as well, that we see both in the pre-pandemic data and the 2020 data, which is why do we have this spike during the spring months. Riley already said that it's kind of hard to tell, but you might have something to add there as well.
Okay. Yeah, so, and Riley, feel free to jump in if you have thoughts as well that I don't cover. So in terms of policy, I mean, anything that I say about that is definitely going to be speculative because we don't have the variation in the data that we're using, you know, the setup that we have just isn't really well suited to that. And I don't know for sure if there may be a country or a city or state or province somewhere that that has used some interventions that would be helpful to identify the effects of different policy measures to counteract the domestic violence effects. I think, you know, I really would like to know how much of this is driven by the economic downturn. That might be knowable if there's enough variation in the relief that's going out, you know, to different populations. There may be something usable there to see how households that get, or areas where there's higher levels of financial relief, whether the domestic violence effects there are then kind of counteracted or erased. But I don't, you know, I don't have a clear answer for that question about what policies will definitely work because it's still open in my mind. But I think I know that domestic violence support groups are thinking a lot about these questions, and I would be interested to see what thoughts they have. I think people, you know, the people who are really boots on the ground in domestic violence support may have some more concrete ideas about what could be done to help the victims that they deal with. Maybe facilitating moves, you know, that's probably something else that's become harder during the pandemic. People may not, like, I don't know if domestic violence shelters were still operating as usual and things like that, but finding ways to keep those resources open for vulnerable people could also be useful. But again, I'm kind of speculating here. And then the other question was, sorry, Veronica, you might need to remind me of the second thing that you brought up.
The seasonality of
seasonality, that's right, the seasonality. You know, I don't know. It is like hot days are linked with more violent crime in general. And I don't know why that is. It may be something that psychologists or, you know, people who study physiology may be more well suited to answer than economists. I'm not sure, but you know, there's a lot of crimes that see an upswing in the spring, and there's been studies on like not just domestic violence, but violent crime rates on hotter days versus like unusually hot days compared to unusually cold days. And hot days, there's more violent crime going on. So I don't know why that happens, but I can tell you it's not just a domestic violence phenomenon. It's definitely pervasive across other types of violent crime as well.
Thanks, Emily. We are getting questions about the policy angle because, of course, it's kind of frustrating to just say, oh, we're locking women with their aggressors at home and we're recording what happens with violence, and then what do we do, right? So I think that you have an opportunity, and you talk a little bit about that, showing us suggested evidence that the transfers to households to relieve economic pressure within the household might be helpful to contrast the increase in violence. So it might be interesting to see if either you or Riley have more insights about that, if that's the channel that you can push forward and kind of guide policy in that sense. If it's a money issue, if it's conflict due to stress generated by income losses and like uncertainty to cover the next meal or stuff like that. And it's also related to the type of violence as well, and the increase that you see in new violence. So could you elaborate a little bit more about that increase that you see, that decrease that you see once the transfers start in the
I mean, so there was, if there were variation across space in terms of when the transfer checks went out, I think that would have been helpful for us as researchers. I don't know if that would have been good policy, but Raj Chetty, Riley was just showing me this morning, Raj Chetty has a paper where he, for some population, has information on when they received their transfer checks, and almost all of them got their checks on April 15th, like the vast majority. And that's right in the middle of when we first see a drop down in that event, that kind of extended event study figure, and the effects and the following week as well. And I agree with you that that is an exciting possibility. I would be thrilled to know that, you know, to have my beliefs confirmed that relieving some of the stress that families are facing has these spillovers to other aspects of their lives as well. That would be hugely valuable to know. I think without more variation, and maybe that variation will come as more stimulus checks are provided in different places or to different groups of people. I don't know what else I can say about that that's not kind of overreaching beyond what I can actually pull out of our analysis here.
So if I can just sort of follow up with that, I think there's a couple of policy questions that we can't really say much about, but are sort of left open. So one thing that I find really interesting is, like, we see that people started social distancing well before they were mandated to. And that's when we see the rise in domestic violence. So I think part of it is they're endogenously choosing to self-isolate, sometimes in dangerous situations, because there's sort of this uncertainty about the virus. And so, like, something I think that could be potentially meaningful, and not that we really can say anything about this, but like the idea of resolving that uncertainty and actually like getting the virus under the control could actually be helpful for getting people out of the home, out of those dangerous situations. And so that's like a different line of policy that we really can't say too much about, but I think there's probably potential there as well. And then the other thing that I was thinking, like, if you look at our heterogeneity, like we can't really say that we don't have the statistical precision to be able to say certain groups are responding more than others. But one thing like that was sort of surprising to us is we ended up seeing larger coefficients on populations where they had lower predicted layoffs. So essentially what we did is we said, let's take workers by their industry and let's match that up with the BLS in a jobs report and see which areas would we predict to have bigger or smaller layoffs. And we were sort of surprised to see that the effects, like the point estimates at least, were larger in places with fewer layoffs. And that sort of just, I don't want to say confirmed to me, but it made me aware that perhaps it's sort of this idea of, if we have lots of people who are still working, potentially working at home, and just like you could imagine the entire routine is disrupted if they have kids staying home from school they're trying to teach as well as trying to get their work done, like that could be driving people sort of over the brink sometimes and making them lash out in ways that sometimes lead to domestic violence, which I think maybe also is sort of consistent with the idea of these are new households that seem to be sort of getting drawn into domestic violence. And so I don't know if you have ideas as to how we could maybe test that or see if that's leading to it, we'd love to hear that. I don't think I don't want to hang my hat on that. I don't feel like we have the ground to really do that, but I think that's something in the future that would be interesting to see if there's that. And then there's potentially policy avenues as like being able to provide safe childcare and schooling could potentially relieve some of the family stress, things like that.
Thanks, Riley. I have another question from Boaz Anglade. Did you include the number of cases by cities as a control? Because that would take into account the fact that it did not hit, the shock did not hit all 15 cities in the same way.
Good question. We haven't used the number of cases as a control. We were just looking at the distribution of cases geographically to see if the cities in our sample were, how hard hit were they compared to the country as a whole. Urban areas in general have been harder hit in the United States so far. And so they're kind of above average for the whole country in terms of their case rates. You know, it's interesting that the timing of the behavior changes is so tight across the country when you look at the cell phone tracking data and the restaurant eating in data and things like that, because as you say, the cases, you know, the outbreaks in different states didn't really take off all at the same time. I don't know if you're thinking of variation in timing across space and when outbreaks started to occur, or whether you're thinking of the intensity of outbreaks. Both of those are a little bit different. And I suppose we could try to use outbreak intensity for timing instead of these behavior changes. It kind of, and you know, maybe that would be informative. I think it's more intuitive to me to think about when behavior changes drastically, which is all kind of happening at the same time. But if, you know, as Riley was saying, this uncertainty and stress about the disease itself is a major factor, then maybe taking more advantage of the case data would be insightful.
Okay, great. So we have one final question again on the seasonality. I think there was a very shocking pattern that you showed in your data in all years. So the specific question about this is, do you know if there's any correlation with the seasonality of unemployment as well? If you looked at this, the seasonality of violence in relation to other variables that might move in the same way, because it's surprising that during the spring people tend to be happier. I understand the thing about the hot days, literature and crime, but you tend to spend more time outside as well. And it's a nice comparison of the winter where you have to isolate because it's too cold and the lockdowns increasing violence, but seeing this spike in the violence during the spring, which is kind of counterintuitive. But have you looked into these patterns for unemployment and other variables that might be moving at the same time?
You know, that's an interesting question. I think, you know, not everywhere has good weather in the spring. I will say that. The warmer seasons in the southern United States can be pretty unpleasant, and the winter might be more pleasant. So I'd say that not everywhere in our sample has the same, like, ideal months for spending time outside. And as I said before, this thing about heat and violent crime is very strange to me as well. I will freely admit that. I don't understand what drives it. It's not just a thing in places that, it's not like just when things get unpleasantly hot. It's like increases in temperature. My understanding is increases in temperature along kind of the whole range of temperatures that we observe are associated with higher rates of violent crime. I'm not super familiar with seasonal employment patterns in terms of when employment rates are higher and lower. I don't think that anyone could feel free to check this for sure, but I don't think that they are decreasing as you go into the spring. I think employment rates are, you know, increasing over that time frame, but you know, you should feel free to double check that. So I don't know that the seasonal trends can be explained by unemployment patterns.
Okay, thank you very much, Emily and Riley, for joining us today. I don't think we left any questions unanswered, but if anyone has still questions to pass on to Emily or Riley, please send us an email and we will make sure that we get them to them. Thanks again for joining, and thanks everyone else for attending the seminar.
Thank you for having us, Veronica.
Thank you. Bye-bye.